Good evening, ladies and gentlemen. Welcome to today evening's clinical meet of Academy of Hypnosis. Today we have with us a very experienced doctor, Dr. P. Rajiv sir. He has done his BSc from Karnataka University and he is also MD and has done his MD as a physician. And sir is going to have a very interesting talk with us. The topic of his discussion is anxiety disorders with special reference to OCD and the out-of-box therapy with anchoring of the intrusive obsessive thoughts. And we hope to learn from you, sir. Over to you now. Thank you so much.
Thank you very much, Nidhi, for the wonderful introduction. At the outset, I would like to express my gratitude and thankfulness to this wonderful organization, Academy of Hypnosis, which is having its second international conference at Pondicherry shortly. The role of hypnosis in the treatment of various mental conditions and physical conditions is now being accepted by the medical fraternity. And the Academy is doing a wonderful job in this. And I'm honored to be a part of this organization. Thank you very much, organizers. At the outset, I would like to express my opinion, how I'm going to present. The schema is, I will have the introduction, what OCD is, then etiology, pathogenesis, and pathophysiology, how the disorder presents and how we are able to diagnose it, the overlapping conditions, what it has, and the next part is imparting the knowledge of spiritual science to our client, our subject, our patient, and then I come to the treatment modality. Questions can be kept towards the end of the session. I'll be too happy to share with you whatever I know. OCD is obsessive compulsive disorder, which is coming in the ambit of anxiety disorders till recently. The Diagnostic Statistic Manual is the one which actually classifies. These are all classifications of disorders, how it goes. Now we have got the obsessive compulsive related disorders. In these group of disorders, we have hoarding disorders, body dysmorphic disorders, trichotillomania, excoriation. Trichotillomania is the hair pulling disorder. Then we have excoriation, substance and medication induced, and OCD due to another medical disease. For instance, some liver problem or some kidney problem, things like this. As far as we are concerned as hypnotic psychotherapists, we have to diagnose whether the OCD is a primary OCD or an OCD overlapping with other problems. This is very important for us to use the OCD. We may get references of this from other physicians, other organizations, other psychiatrists, or they may directly come to us for treatment. Therefore, we should know certain things of this kind of, that's why I wanted to highlight at this point of this DSM-5 and all that stuff. What are the components? Basically, we have the obsessions, which is the thoughts. These obsessive thoughts will obviously have some kind of effect on us because they are ruminating, they are distressing, they are stressors. So it produces an amount of anxiety within us. Now, what happens when we become anxious? When we become anxious, our sympathetic nervous system, it starts getting activated. It produces cortisol, noradrenaline, adrenaline, catecholamines, which is necessary for us to fight the stressors. Our heart rate goes up, our respiratory rate goes up, we may get tremors, we may get abdominal discomfort at later on stages. Initially, there will not be anything. These hormones are very necessary for us to fight the stressors. And as you know, as we all know, that stress has got fight, flight, freeze. This is how it happens. Now, prolonged stress, when we go through this for a prolonged period of time, then naturally the result is quite bad. But here, what happens? Obsession, anxiety, the subject does some repetitive behavior, and then he is normal. He feels he's relieved. So this cycle keeps repeating again and again. We need to break the cycle. That is what we have to do as a psychotherapist. My focus today is on OCD, but the same thing is applicable to many of the anxiety disorders. When I come to the diagnostic part, I will try to elicit a little bit elaborately how important it is for us to distinguish between a minor depressive disorder and a major depressive disorder. What are these obsessive thoughts? These are intrusive, repetitive, resistant, and we are aware of these thoughts. We know these thoughts are coming. And what is the theme? Contamination, harm, perfectionism. Then we have got religious scrupulosity, sexual obsession, relationships, existential or philosophical obsessions. So all these kind of things can come to us as thoughts. So these are the things which tries to produce, gives us the anxiety. We become anxious and we start doing the repetitive, driven by anxiety, unrealistic. It is basically ego dystonic. It recognizes that what we are doing has got no logic, but still it is irrational. But we keep washing our hands because we feel that we have touched something dirty. Keep on washing to such an extent that we injure the skin, arranging the things again and again, thinking that it's disturbed us. We keep doing it again and again. We want a particular fashion and we avoid a kind of avoidance attitude. What does all this do? There is a marked functional impairment. So this is basically what is OCD. Now, I will come to the etiology. OCD is, there is a genetic component here, neurobiological component, there is a neurodevelopmental component, there is a psychosocial component, there's an environmental component. Now, we should know this basic things for us to understand about the disorder better. Most of the mental disorders have these components: genetic, neurobiological, neurodevelopmental, psychosocial, and environmental. So we have to most of the disorders. But in this OCD, we don't have any particular gene which we can do a test and see. There are so many genes, and it is still research is going on. So there is no point in doing any particular like telomerase length and some things like that. There's no point. It is a clinical diagnosis. Now, what is neurobiological? Now, neurobiological, you see, we have the neurobiochemical markers. That is the neurotransmitters, serotonin and dopamine. Serotonin levels being low, it gives rise. There is an abnormality in the levels of these neurotransmitters inside us. Then the second thing is we have the cerebral cortex, we have the stria, we have the thalamus, which is deep inside, and again cortex. So this particular circuit of information which goes on, there is a dysregulation there. Then we have the genetic and epigenetic response we already know about. That is the third one. Genetic, we are already born with certain problems, and then epigenetic, environmental factors and certain other factors, stresses, it tries to trigger it. Remember that our cortex, that is the outer layer of the brain, and many other structures in the brain develops from when we are born, when we are in the mother's womb. It is in a very, very underdeveloped stage. We have just got the existential brain into us. And even when we are born, that's what we gaze, we are not having any idea. Only after the age of 2, we are slowly able to recognize and things like that, and up to 6. So this disorder basically affects between the age of, say, the early childhood, around 9 to 10, around 6 to 12. This is the age group 7, 8, 9, 12, and it can come at any age. I'll come to that when you talk about the presentation. Then we have the overactivity of a particular part of the brain, the anterior cingulate cortex, which is responsible for the cognition behavior. It acts more. This is the fourth one. Then there is the structural and functional problem in the brain. We have the orbitofrontal cortex, the cortex lying area behind the eyes. It is shrunk. The volume is less in the individuals who have this problem. And caudate nuclei, another particular structure in the ventricles, they are enlarged.
And as I mentioned to you, there is what you call corticostriatothalamocortical hypermetabolism. Now, therefore, because these structural things are there, functional things are there, I insist when I treat a patient, I insist every patient of mine should have a functional MRI. A functional MRI of the brain will certainly give us the idea whether there is any organic problem or whether there is any functional problem. This will be clear with our provisional diagnosis when we ask, or when the patient has already got it, we don't have to do it. And also an electroencephalogram to see if there is any sleep disorder. Both these two things are important for while we treat any mental health person. Then we were talking about the developmental disorders, low birth weight, maternal stress, these things can cause. And environmental is childhood, trauma, stress. These are the things. Now I come how the disease presents at what age. Like I told you already, early childhood, it can come at the teens, adolescence, and if it goes on for a further period of time, and if it is not diagnosed at the right time, proper parenting, parents notice it, they also have had it, they will be able to understand it. I forgot to tell you, coming to the etiology, and the presentation was here. 2 to 3% of the population, entire world, have suffered the obsessive compulsive disorder in their lifetime at least once. It has got no gender discrimination. Both men and women are equally poised for this particular problem. Like I told you, the age is childhood, between 9, 10, 12, teens, and it goes on to the adolescent. And if it is not caught off at the correct time, if it is not nipped off at the bud, then it can progress. It can have marked functional impairments. There can be relationship problem, career problem, social isolation, occupational decline, physical health issues, chronic stress, and even psychosis, that is a major depressive disorder, and suicidal ideation. Friends, please understand, people with this obsessive compulsive disorder, when it progresses, it is the people at home who are affected. The others, the caregivers, the husband, children, the brother, the sister, the family, the friends with whom they carry their life, they are the ones who are actually affected. What are the comorbid conditions which can exist along with this? You have got general anxiety disorder, we have got social anxiety disorder, depression, and then these are the kind of things which they can have. So diagnosis of the right diagnosis at the right time is very important. Here, I would like to add one point. None of us in the school, I come in the senior citizen category, and I'm sure many of you too, we were never taught anything about spiritual sciences in our schools. The knowledge of spiritual sciences from the age of 10, from the 10, that is from when we are in the secondary school, when it is imparted, it will build a resilience, a capacity for every individual as he grows to come back quickly from the moments of stress back to the normal self. That is what we call the equanimity, the euthymic state. When we go into a euphoric state, when we go into a dysthymic state, when we go to dysphoric state, we are able to come back and be ourselves. This is a very important characteristics which develops by having the knowledge of spiritual sciences. Let me tell you again, spiritual sciences is not connected to any religion. All religions are just languages to spiritual sciences, and spiritual science, like medicine, like hypnosis, it is a social science which gives the correct knowledge of mind. Please don't think it is related to any god or any deity. No, it is only the knowledge how we can keep ourselves resilient. Now, I come to the next part. How do we make the diagnosis? A client has come to us and we have to take, here is a clinical diagnosis. If we have got blood sugar, if we have got headache, if we have got hypertension, we can check the blood pressure, we can get the blood sugar done. Here, there is no particular biomarker. So it's a clinical diagnosis. There are so many overlapping conditions which goes along with this. Anxiety disorders, general anxiety disorders, personality disorders, social anxiety disorders. Then we have got body dysmorphic disorders, autism spectrum disorders, attention deficit hyperactivity disorder, Tourette syndrome, tic disorder, post-traumatic stress disorder, eating disorders. So many of them, it can even be into a major thing, but they come to us with a problem. With this, we don't think about those things because they haven't told us, and we just assume that it is only this, but it can be with some overlapping condition. Therefore, a thorough medical history, very important. Even if the client is coming to us from an organization, we should check it ourselves. Like if somebody comes to me with a blood pressure recording of this much, I will always check it up myself to ensure if the value is correct or not. Similarly, we as hypnotic therapists, when we get a patient, madam or sir, this is a case of OCD, please give hypnotherapy. We shouldn't just follow what they say. We should try to collect the history. We need to spend some time because we are dealing with human life and it is our reputation. So we should try to keep it up. Therefore, a thorough medical history, a thorough mental history, that is psychiatric history, a proper psychiatric evaluation, that is a mental status examination, very important. We need to get the mood questionnaire. There are several questions asked. Did you have a feel like this, feel like that? We can always get it on the net, and I have it. Anybody wants it, you can please write to me and I will send an email or ring me up. I will send it to you. There are so many questionnaires. We can pick and choose whichever we want. It's available in the net. Then we have what is called as an egogram. Like I told you, many of the disorders which we have is rooted from the childhood. Like we know here, we have developmental disorders, childhood stress. The child may not be knowing what is the stress which the child had, but we will be able to know it by the egogram. So by doing all these tests and having the master health checkup along with the MRI and the electroencephalogram, we use a formula which is called as a DSIGECAPS formula to differentiate between what is a major depressive disorder and what is a minor depressive disorder. A client who has come to us with OCD, if he is coming under minor depressive disorder, we can go ahead and give our hypnosis. Otherwise, we should refer the person to a psychiatrist or to a physician who will then decide. Better why directly you can refer to psychiatrist. What are this DSIG? D stands for depression. This is the D. The D stands for depression. I stands for interest in self. G stands for guilt. E stands for energy. And like that, there are each word. C stands for concentration. A stands for appetite. P for psychomotor activities. And S for suicidal ideation. Now, we get all the answers for this formula. The DSIG CAPS formula was used prior to the ICD-10, International Classification of Diseases, which before it coming, this was the formula which was used by the Esther-Year psychiatrists. For us, this is enough. By using this formula, I'm able to classify, yes, this is OCD, or this is a substance use disorder, or this is a simple anxiety disorder. Now we are talking about OCD, right? So we will stick to only the OCD, the obsession, obsessive thoughts, and the compulsive behavior. Now, when I have diagnosed OCD, I have to know if it is a mild, moderate, severe. Is it mild to moderate, or is it mild, or is it mild to moderate? Is it moderate or moderate to severe? Is it severe, or is it severe to very severe? Now, if we see that if it is severe to very severe, again, it means that he is the borderline and he needs medication. Only after giving medication, we can impart this treatment, what I'm telling you. So we need to refer the person. How we can make out this classification is by seeing the intensity. If by seeing the person, by understanding, you can, oh, this guy has got a very severe, this one. So it is better for us to seek the opinion of somebody else. In medical practice, we should always remember that we are treating human beings and we are not doing any tests on some animals. Even that we should be careful, only it's warranted. And human beings, we've got other specialists. We need to get their opinion. And this is my humble request. Please don't feel bad that I'm telling all these things. So once we know that it is mild or mild to moderate, we'll definitely give a treatment. I told you what the overlapping conditions are. Overlapping conditions, we refer to the psychiatrist. Next step is we give the knowledge of the spiritual sciences. I'm an Indian. I have learned my Indian spiritual sciences. So in my purview, it goes with Ahar, Vihar, Vichar, Achar, and Vikar. The food, what I do, the amount of time I work, the rest what I take, the thought process, then systematically following these things, and then I get transformed. There's a particular time to eat food. There's a particular time to have breakfast, lunch, dinner, sleep time, sleep hygiene. All these things is taught in the ambit of spiritual sciences. And the knowledge of spiritual science, like I told you, it gives us the right knowledge of mind. Mind is the multiple information going in the normal direction through our sense organs. Sat Vipra Bhaguta Vadanti. The same energy which is in you, which is in me, is there in all the living organisms. It is there in the plants, and it merges with the cosmic energy. So this energy is one and the same. The same energy just keeps moving around. Quantum physics talks much about it. Tat pind, yat pind, tat brahmand. How we feel, so is we realize about the universe. Now, there is Vishada Yoga Shastra. That is basically despondency and dejection, which is taught through Bhagavatam. Bhagavatam is again nothing to do with any religion. It is the sutra. And I request Nidhi to please share the telephone number and or the email ID for all. I want to share a 1.5 minute video which a spiritual scientist has explained Bhagavatam, how it is 5 senses, our 5 senses, and what each sense means in a wonderful way for us all to understand. So we treat the mindfulness practices, we doing one thing at a time. And we were talking about the thoughts. When we are in mindfulness practices, we get a lot of thoughts in our mind. There are 70,000 thoughts all of us get every day. Can you imagine, from morning to evening? Thoughts come, it goes. We just don't know. It is coming and going because we are involved in our job, we are involved in our work. So it just passes off. Certain thoughts, like good thoughts, creative thoughts. Good thoughts is we have to get up in the morning, we have to do our routine things. These are all good thoughts. Creative thoughts, do something new, create something. The good thoughts and the creative thoughts should be improved for us to increase our neuroplasticity to increase our brain volume, to see that there is no any clutter. So there's no any lymphatic clutter. All the levels of the neurotransmitters are flowing quite all right. And we are at ease. We are in an absolute euthymic and blissful state. So we teach the Pancha Tattva Pranamam. Our body is made up of 5 tattvas, 5 elements. We teach them. We have to pray for all these 5 elements of our body. The chakras, the chakra theory, the kosha theory, pranayama, the yoga asanas, all these things, the humming bee exercises, all these things improves our resilience. It actually builds up the parasympathetic nervous system, which is the one which actually combats. It's exactly opposite of the sympathetic nervous system. Sympathetic accelerates, parasympathetic brings down. So the spiritual science is able to address all these things. Next, I ask the client to take a paper and pen and write down what are the rumination, the thoughts, these obsessive thoughts which has come to his mind. The main culprit is thought. It is a thought which is holding. So he will write down, he will sit down and write down. I feel that my hands are contaminated quite often, that I have not locked my house, that I have not off the geyser, that I have not given medicine to my child who is just 2 years old and I send the child to school. All these things. So I will ask my client to write down all these things in a paper, and I will insist, like every day before you leave your house, ensure you have done all these things. These are the thoughts which have been coming to you time and again. So you make a checklist and see that all these things is done. So once it is done, take the paper, tear it off and throw it over. Just keep the paper there. Take another paper and pick it up and throw it off. So you're sure that you have checked it again, that everything is done. So even if a thought comes, you can dismiss it, or you can say, no, don't trouble me. I have already done that. This kind of thing. Now he comes to his office. Then next I teach him what is the auto rejection. These thoughts need to be rejected with a positive force, which will reject it. Here, I will teach my client to get the mudra, to get this anchoring technique on his Shakti mudra. This is our palm, and this is Shakti mudra. When we fold the thumb in and hold it all together, this becomes Shakti mudra. So I'll tell him, when I ask you to hold your palm, please fold your right palm like this. So he will understand, right? I'll do that. Then I'll ask him to sit down. Before I start my therapy, Paran sir has taught us the palming exercise, the palming kriya for having a focus on what we are doing. So I'll ask my client to do palming so that he's focused on what I'm going to tell him. After he does the palming, I'll ask him to stand up, put his left hand out with his left palm facing the sky. Keep his eyes gently closed. I'll ask him to get all the thoughts which he has been getting on his left palm. And oh, I'm sorry, I made a small error here. That is a different. I'm sorry, I'll come back again. What I will do is I will ask my client before I do the palming. I beg your pardon, apologize. I'll ask my client to imagine a situation where it was, because I'm doing an anchoring technique, so I have to anchor a positive event which has taken place in his life. I will tell him, please imagine a situation in your life which has been very devastating. There was no light at the end of the tunnel. Everything was looking spotty, gloomy, and all of a sudden there was a divine touch and you succeeded. Please imagine something. We all have had such situations, touch and go in our lives. Then I ask the client, are you able to get something like that? So he thinks for a while. So while again he be using our what you call yukti of therapist, how his eyes are moving, whether it is which is his preferred representation system. It is visual, or is it auditory, or is it kinesthetic? Accordingly, we can try to address when we converse with him. It's very important as hypnotists for us to use this kind of language, the preferred representation system. So he says, yes, sir, I've already got it. Then I'll ask you to start reliving it from the beginning. And the moment you have achieved that is success, you will be, just give me a nod that you have. And at that time, naturally, he'll be smiling because it starts in a very bad face. I'll ask him to do the palming. Now I'll ask him to do the palming. After doing that, I'll ask him to stand up. I'll ask him to put his right arm outside because I'm going to do the anchoring of the right arm. I'll ask him to put the right arm out and close his eye gently and relive this particular occasion of what happened. Incident, not occasion, incident. So he said, yes, sir. Then slowly. This is all in a state of trance. So he has done the palming. We will ask him to breathe in, keep awareness breathing. Once we know that he's in trance, then we are all hypnotists. So we are well trained to do that. So in trance, he's able to visualize that. He gets those thoughts in his mind. His face is quite saddened. You can make out by the expressions. And then after a while, say about 1 or 2 minutes he'll take. Then there's a smile in his face. And then he nods. Then you use your ring finger and your thumb and anchor it on his forearm and ask him to close his fist. When he closes his fist, he closes it in Shakti Mudra and release it. And ask him to sit down. After a while, ask him to again breathe and close his fist this way. If he is able to get that particular episode of enlightenment or that kind of getting out of a very devastating situation, then that means your anchoring is worked well. Otherwise, we'll have to do it on some other day or ask him to come again, because if you do it immediately, it will be too tiring for him. Most of the time, you will succeed. It's only 1 out of 99, 100 times you will probably need to have to do it once again. So once you've anchored, this auto-rejection can be done in a very good way. I'll ask him to go home. I taught him knowledge of spiritual sciences, all the exercises, what he has to do regularly, morning and evening, before sleep, what he has to do, early morning, what he has to do. It takes quite a lot of time to teach him all these things. I taught him anchoring. I will not teach him the next part because that will be too much for him to assimilate. I'll ask him to get back to me after 3 to 4 weeks. And I would have given him my telephone number and my landline number that I'm available for you 24/7. Just follow what I'm saying. If there's any problem, please get back to me. And I'll ask him to write down in his diary, day to day, how the thoughts have been regressing. Because while doing these kind of kriyas itself, his resilience has built up and his volume has improved. His neuroplasticity has increased. So many things have taken place within the organism without his knowledge. Plus, he has got the rejection thing. So I will ask him to do that. Then come back to me in 3 to 4 weeks. If it comes in between, then I will find out what is the reason and accordingly plan my this. All our treatment is subject to change. We can design different kinds of treatment. Assuming that he comes back to us after 3 to 4 weeks and says, sir, I'm feeling much better. I'm all right. I did get a few thoughts even after auto-rejection. Auto-rejection is done like this. Once these thoughts come, you will ask the client to just tap it on his chest like this. So the thoughts are rejected. Because this rejection, he understands. I've already done the checklist and there's no way that I can, so just go back, go off, get lost, get lost. So this is auto rejection for the thoughts. Despite that, if some of the thoughts have entered and anxiety has come, then he will do this repetitive behavior, what he's doing. When he comes back, you see the graph, how the graph has been going. With this spiritual science knowledge, what you have imparted, with this anchoring of auto rejection, which where he uses, how the graph has come down, or is it the same? If it is the same, you have to ensure, as he been doing regularly, as he being, see, what we are doing is a lifestyle management. We are changing his lifestyle. We are trying to modulate his lifestyle, whether he's followed whatever we have told him. We have to ensure that. We have to ask, do some CID work. We may have to ask his relatives at home, because he may tell us something which may not be absolutely true. So we always ask the client to come with the spouse or brother or sister, or father or mother, so that we can collect more information. Of course, there are situations where privacy is required, but there are very situations where we need to get, like we say, collateral evidence, corroborative evidence. We need to prove what was being told to us is correct or not. So when he comes the next time, I'll say, don't worry, you are doing much better. I see there's sort of reduction. I teach him what is called as fusion of the obsessive thoughts and the compulsive behavior into a seed, and the seed to be germinated into a soil. I've already dug a pit and kept ready. I told my client that this is what I'm going to do. Again, I will ask him to do palming so that he's able to focus, and I'll ask him to breathe, and in trance, I'll ask him to stand up. Now I'll ask him to put his left hand up, palm facing on top. Please get all your thoughts which have been troubling you on your left palm, all those ruminating, repetitive, distressing thoughts. Are you getting it, the thoughts one by one? And as the thoughts are falling on your left palm, it's becoming warmer, because thoughts are thought energy, and it is becoming heavier. And once you get all the thoughts, give me a nod. All the thoughts have come, he nods. I ask him to close it. This time he just closes. There's no mudra here. He just closes it. I'll ask him to sit down. Again, after some time, I'll ask him to breathe. I'll ask him to stand up. Put his right hand out, palm facing on top. Get the compulsive behaviors on your, whatever compulsive behaviors you have been doing, like hand washing, arranging, telling some mantras, or counting, whatever it is. Get it on your right hand. Slowly, I'll ask him, are you getting the things? He nods, or he says, no, he's not able to. When he's not able to, that means he's not in trance. I'll further induce trance. I'll get it. Then he says, yes, he's getting it. Once he has got it on his palm, I'll ask him to close his palm. I'll ask him to sit down. After a while, I'll ask him to stand up. Then keep both his hands this way. Basically, this is almost close to Ganesh Mudra. So it is the blessings of the God Almighty is there, and we are fusing it. We do this, and then we ask the client to do that. So the seed is there. The seed is to be germinated. Now we'll ask him to get up. He's already got up, and we'll ask him to put it inside the pit and pour some water, close it, put some cow dung, sit down, and in Anjali Mudra, say Namaste and say Tatastu. Let it be. Tatastu means let it be. Whenever we pray to God Almighty, we should also accept. We keep asking for so many things. We should thank God for everything what God or whatever you call, and then accept what he is giving in return. So Tathastu. It's a good way of seeing that what we do comes true. I will ask him to every day in his mindfulness practices to see how this plant germinates. This is a plantain tree, I told him, which is going to grow, give nice, beautiful leaves, plantains, flower, and we are going to enjoy this for about 20, 25 years. And you will get rid of all your problems without your knowledge. Every day, he's been asked to visualize this, pour water, and see how the plant grows, visualizing techniques. And I also tell him that in case you get some thoughts, we always get the thoughts, take it on the left hand. So one odd time you get a thought on a day, please, on that day, you do whatever repetitive behavior you want. Stand up, take those thoughts with your hand, sit down, get up, burn those thoughts, make it into ashes, put it into the plant as a manure for the thoughts never to come again. If you have done a particular behavior, you can take that in your right palm. You will not have done because you have already become so resilient and all those fusion you have done, only one odd thought may come. Mostly it will be the thoughts which has to be burned to ashes, and that has to be used as manure for the plant to grow. So we have this therapy for people who are ambulatory, that is people who can walk around, say about 50, 55 and all that. When they are senior citizens, when they are not able to walk, they have got some other problem where they're bedridden, we have got another technique. This is coming for the ambulatory people. For the other people, we can do what is called as EFT, Emotional Freedom Technique. Again, there is a particular prayer which is to be told here. The exact words, I will send it to you. Nidhi, kindly give me all their telephone numbers. Here, there are 12 points in our body which we try to address. We ask the client to sit down in a comfortable position. If they cannot sit down naturally, because I said bedridden, if they're lying down, they can be in a lying down position. No problem, whichever position they are. Then ask them to take deep breaths. That is part of every this one. Deep breathe in and breathe out, breathe in and breathe out. Be aware of your breathing and do this. 1, 2, 3 on the hands this side. This is one point. Number one. While we do this, we tell a prayer, which is, although I'm having these thoughts, these ruminating thoughts, which keeps troubling me into anxiety, and I do this repetitive, this obsessive thoughts make me do this repetitive compulsive behavior. I am quite comfortable with it and I am remaining in it. I now wish to send these thoughts from where it came. Keep telling that again. This is one point. This is the second point. Second point, is the sagittal area. Second point. That you should not use this area. This is called a sagittal area. This one. First is this. Say about 10 to 20 times. Second is this. Keep telling the prayers. Third is the eyebrows. Fourth is the temple. Fifth is below the eyes. When you come to the below eyes, you can use 2 fingers. Here, when you start, you do the entire thing. Here you use 4 fingers. Here you use 3 fingers. And again 3 fingers. 2, 1, 1. This one. This one. This one. When you do this, ask them to put chin mudra. This one. This one. And again this one. So total 12 in number. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So 12. This is the emotional freedom technique. It is similar to the EMDR. EMDR takes a longer time. Eye movement that takes a longer time. this has got the same effect. It can be done for, you can use it in any disorder. This can be used in obsessive compulsive disorder, any other anxiety disorder, for any pain. It again improves the resilience. Last time we had a talk on this when Nidhi was speaking. Somebody said about the exposure response prevention. It's really a cruel thing to do. And I was in full agreement. If all this doesn't work, then we can think of going for the ERP. So with this, I conclude my presentation. I am now open to take any question. We can keep this what you call discussion open. Thank you very much. Thank you.
Thank you, Dr. Rajiv, for a comprehensive presentation which included many alternative forms of healing.
I'm not able to hear.
Hello?
Am I muted?
Yes, sir. Yes.
I'm not able to hear.
Hello? Am I audible, sir?
Hello?
Am I audible?
No,
Right?
not audible.
Someone else?
Yes, sir, we can hear you. Rakesh,
thank
sir,
you.
we can hear you.
One second. I'll try to use the other phone. 1 second.
Yes, sir, please. Take your time. So
I'll
we
use the other- 1 minute.
yes, please. Can you hear me now, sir? Your frame is freeze, sir.
Sir, I think there is some problem at Rajiv
Yes.
sir's network
Exactly.
because his screen has frozen.
Yeah,
There
yes.
could be some internet issues from his end.
It seems. Let us wait for some time.
Just message him on WhatsApp, please.
Let him be back. Huh? Yes, sir.
You could message him on WhatsApp or make a phone call.
Okay. I think his connection has dropped. He may be rejoining. Yes. He's back. He's rejoining.
Sorry.
Yes, sir. Sorry, sir. It's all right, sir.
Yeah.
Yes. So we have a very good and comprehensive presentation on
Thank you, sir.
obsessive compulsive disorder.
Yeah.
Very informative. There's a feedback. And we learned many forms of alternative healing which can be utilized for obsessive compulsive disorder, and they can be used in other neurotic anxiety disorders as well, I think.
Yes.
So yes. So audience, this session is open for discussion. Anyone please to raise a query is available.
You're able to hear me, sir?
Yes, sir.
Are you able to hear me?
Yes, sir.
Yeah.
So anyone from our audience, any query?
Good evening, sir.
Good
Yes,
evening,
sir.
doctor.
Yes, Dr. Ash. Yes, please.
It's a wonderful section, I have to say. And we are new to this concept also. We are just now we have started doing this studies also. For us itself, it is very able to understand easily and informative. Thanks for the same, sir. Thank you very much.
Thank you, madam.
Good evening, doctor. Actually, I am Asha Rani from Chennai. Just now, my friend spoke. She's Aryamala. We both are doing internship in SDS Academy under Dr. Santanam. Actually, all the informations given were really very good and easy to understand. I have a query, doctor. Like you were talking about EFP, right?
Yeah.
Emotional freedom, and P stands for what?
Technique.
What is it? Okay, it is
Emotional
technique.
freedom. Emotional freedom technique.
Okay, this is this techniques can be it can be used only for the old ages, or we can use it for the like normal people who can be calm and composed, like without any OCD problem also. You were
Yeah.
teaching about the techniques, right, doctor? So can we use it in a daily basis so that it would be helpful?
Yeah. See, Palan sir talked about palming
Okay.
exercise. Now, once we do palming, we get more focused.
Okay.
We feel totally regenerated.
Okay.
The same thing comes with EFT also. When you have no problem.
Okay.
Normally EFT is done when there is some emotional problem.
Okay,
because emotional freedom technique. Suppose you are in a euthymic state, you have no
Okay.
problem. Then there is no meaning in doing something for therapy, no?
Yes,
Whereas Palan sir, what he taught us was for better focusing. That
Okay.
can be done on regular basis. It will improve our focus.
Okay. Okay.
Yeah.
Thank you.
EFT can be very good emotional first aid, in fact, and there are good manual is available for EFT, which can be learned easily and applied, as you say, on day-to-day basis whenever you feel stressed. So it will relieve immediately.
Okay.
Yes, it's a very good procedure.
Thank you.
So there's a request that if you can create a manual, I think Dr. Craig has already prepared the manual and it is easily comprehensible.
So one more question.
Doctor was saying about, sorry. Doctor was saying about that he will be sending a 1-minute video or something.
Yeah.
Shall we send our number through
Yeah,
this
please.
message?
Please.
Thank you. Thank you.
Your telephone number and email ID. I have requested Nidhi to send it to me. You can directly send it also. No problem. I will forward it. Yeah.
One more question.
Yeah.
Saying About the OCD is no gender discrimination.
Can you speak a little loudly, madam?
Okay, sir. You were saying that in OCD, regarding OCD, there is no gender discrimination.
Yes.
So, who are most vulnerable session for this? Do you have any data?
Yeah. See, what statistics say is now if some parenting is very important. So childhood trauma. So parenting, children who have got good parenting and they will not be vulnerable because they will have been properly taken care of. And genetically, if elders have been doing at home, having a problem, then the like ritualistic obsessions, puja, but all too much giving importance to the smaller details, that could be there. Therefore, you cannot identify like that and tell. So we have got markers like the people who are more prone, who are vulnerable. They are the ones who have genetic predisposition. Somebody has got it in the family, the neurobiological, the neurodevelopmental. These kind of. Suppose if somebody has had a stress during the pregnancy, maternal stress, those children are vulnerable. So it's 2 to 3% of the population which has got. Normally, it is corrected by the parents and the parental figures with certain authoritative kind of training, and they come out of it. But when we don't do that, like for instance, I don't know if you know something called a stimming in autism. It's a particular kind of movement with which they are able to communicate with others. And if we try to stop it, he will react. He will become really violent. Therefore, the parent should be quite cautious when he sees such kind of thing, and when he's trying to rectify the child behaves in a funny way, he has to seek the help of a doctor. Your question was whether we can make out, yes, substance use, alcohol, people who take substance, they are vulnerable to this kind of behavior. The alcoholics, people who are addicted people are more vulnerable to these kind of repetitive behaviors because when they don't get something, they do something else. They are vulnerable. People addicted to certain habits, they are vulnerable. That much is for sure. Yeah.
Yes, sir. Among others, I have seen that having a family member with OCD or even OCPD, it acts as a risk factor in the other family members.
It's very painful for the others to adjust. Somebody with OCD for.
Yes, sir. Dal, sir, would like to contribute?
Yeah, I just like to say one thing, that with children, there's an infection called streptomyces.
Yes.
So there's something called pandas.
Panda syndrome, yes, sir.
So what happens with children? They develop obsessive syndrome, they develop tics sometimes, and between 3 and 10 years normally, but I've even seen in later 19 and all. So they need a blood test, and the treatment there is antibiotics. I just wanted other people to know, and the best person to send that person for check out for pandas is a pediatrician, not a psychiatrist or other doctor.
Exactly.
Thank you, sir. Thank you very much.
In children with OCD, it should be remembered that there is a panda syndrome and it can be there. So proper screening will be required, sir. So, anyone else? So, sir, we had a very good session from you today, very comprehensive, right from the theoretical background of OCD, its classification system, its etiology, pathophysiology, and various techniques, hypnotherapy, and that I like that your thought, disengaging with thoughts, that your thoughts are on your palm, your compulsions are on other palm. So it can be a very good technique to give some relief immediately to the obsession. So we have lots of scope, and in fact, research scope in these forms of alternative healing, to what extent they help the people with obsessive compulsive disorder in particular and other psychiatric disorder in general. So there is lots of scope, sir. There are many forms of alternative healing. So I would like to thank all the participants and Dr. Rajiv for sharing the views. Thank you very much, sir.
Thank you, sir. Best wishes, sir. Best wishes, sir. Thank you, sir. Thank you.
Thank you, sir. So we can leave now. Leaving the meeting. Thank you, sir.
Yeah, thank you.
Thank you, sir. Thank you.
Thank you.
Thank you.
Thank you, Nidhi. Thank you very much.
Thank you, sir.
Thank you.